Welcome, everybody. I am Felix Menendez. I am a diocesan judge here at the Metropolitan Tribunal of Atlanta. And welcome in particular to our advocates, which are the audience here. Thank you for being there. Thank you for your generous ministry in favor of the faithful of our diocese. Today, I have a very special guest for you guys, our beloved Dr. Howe. Welcome, Doctor.
Thank you.
How are you? Dr. Howe is the court expert of the Metropolitan Tribunal, and we're going to get into what that is. But before, can you tell us a little bit about your experience in education? So we're going to talk about psychological stuff. Can you please tell us a little bit, where do you come from? What's your education? What did you study to get to be what you are now, what you do now? Can you tell us about your professional experience?
Well, it's great to be here. Yes, so I am a doctor. I have a doctorate in clinical psychology. I started out long ago, though, as an undergraduate, even majoring in psychology, working at I always say that I date my beginning of my clinical work to when I worked at a crisis center with people calling in when they were suicidal. Wow. I did that at 18 to 21. So very early, got some training as a volunteer and did that and majored in psychology. And then went to graduate school. I went from Purdue University out in Indiana as an undergraduate to the University of Massachusetts in Amherst. And that time was long ago, but many years back now, 40 years, I think. Psychology was, it was the program focused on family therapy. It focused on psychodynamic, or I talk about that a little bit later, perhaps, what that is, as well as behavioral interventions. So it was a time of kind of competing theories about the human person. But I gravitated toward doing actual intensive work with people who had severe mental illness. And I did a postdoctoral training then for 5 years at a psychiatric hospital, an open, by open I mean not with locked doors, place for intensive treatment of people with serious mental illness, including those who were suicidal. Did a year also of work with children and families at Harvard University, Children's Hospital in Boston. And after that, I stayed at the institution where I did my postdoctoral training, stayed there for about 20 years, actually, doing a variety of things between the clinical work with the patients who stayed there for a long period of time. Typically, this was intensive work that went on for, a year or two. Usually they would be my patients, and I would see them 4 or 5 times a week. And that was difficult work. I could talk about that more later, but and it informed me a lot about, first working with kids in Boston and their families, and then learning about when things went wrong, how people, the kind of troubles people ended up having when I did the postdoc. So I stayed there, did research, did the clinical work, published a book, did this and that. But then there came a time in my own personal life, family life, when I felt like I wanted to integrate my faith into the work. And that wasn't really possible in that clinical setting, or didn't feel possible for me to do that in that clinical setting at that point in time. So my husband and I decided to move to Atlanta, where his family was. And I started looking around for something Catholic, which is kind of, interesting because the South isn't very Catholic, or thought of as Catholic. But I knocked on the door of Catholic Charities. They had a counseling program. I talked to the director there, and he sort of said, he knew my background, and he thought I wouldn't be interested. He said, there's this really Catholic lady in Atlanta who's a therapist, and but you probably don't want to meet her. And I thought, I'm going to meet her as soon as possible. So that's what happened. And that started a kind of a journey where I was on, of doing this integration of my faith with the clinical practice. So to begin with, I did mostly outpatient, private practice here, while working on developing what's called now called the Catholic Psychotherapy Association. And it's moved beyond me. I was one of the original founders of that organization, and now it's grown, and I'm no longer on the board, obviously, but I'm helpful in a way to the organization still. And then I guess it's been 6 years. I was looking for something a little steadier than private practice, and the opportunity came to work here full time. Although I should say that under the prior psychologist who worked for the tribunal, he had gotten me to do some work for them. I was already doing a psychological evaluation. So actually, that work goes back about 12 years that I was, so I've been around. So, and then I had to learn a lot once I got to the tribunal about what, even though I'd been doing them before under the prior expert, I had to learn a lot more, and actually with your help, about canon law and about marriage and what the judges were looking for in terms of my help, how I could be of assistance. So putting that knowledge, that general knowledge about people and their troubles to work for the tribunal.
Yes, Doctor. We're very lucky to have you, indeed. I mean, you're a great person. That's first thing. I am lucky to count you as a friend. But also, I mean, you're very competent professionally, and that is great for us to have someone we can trust, we can ask questions, and who can answer, not only knowing your stuff as you do. So it's not only the titles, I can tell, right? It's also the real knowledge and, wow, the experience, right? Like assisting suicidal people when you were a teenager. Wow. So we really need someone, not only all those things, but also someone who has faith. Because for us in the ecclesiastical courts, we can use different experts, but of course the expert that is most needed is the psychological expert like yourself. And it's very important for us that the psychological expert has a Christian anthropology, right? So someone who has faith, who has integrated their faith with their scientific knowledge, that's what we're looking for. So, I mean, we are very lucky to have you. And let's get right into the meaty part of the thing. Okay. So we, in the process, need sometimes, when it's an incapacity case, we need to assess if the person suffered what we call in canon law the grave psychological anomaly. So a disturbance of the mind that impedes the person from using intellect and will in a normal way, so to the point that they are unable to establish the contract of marriage, right? And because we are not psychologists, we need to ask an expert. That's where the expert, in Latin, the peritus, comes in, right? But we have different perspectives, right? So we are lawyers, we are jurists. We are looking for whether the person validly established a contract, validly contracted obligations, whilst the perspective of the psychologist is different, right? And we, as you were saying, you learned a lot. Well, so have we. So do we. And this is why I am so excited about this interview, because first, anomaly is not psychological language, I guess, right? Right? You don't speak of anomaly, or do you? I don't know.
I mean, yes, but it's more likely we would speak of psychopathology. So what is the pathology of the psyche?
So please explain that. What is, from the perspective of a Catholic psychologist, right? Please explain, what is a psychopathology?
Yes, well, that there's two ways of approaching it, I think, even in psychology. One is to say, what is the healthy adjustment of a person? What is optimal, or what we hope to be someone's development, human development across the lifespan. And of course, we can talk about that too. There are different stages. Obviously, there are different tasks to be mastered and skills to take on. And then there's the other way of approaching it, which is actually when someone comes into therapy. I could start there, since I'm, a long journey as a clinician. It is they come with distress typically. So either someone else is distressed.
Just a second.
Okay.
I'll edit this out.
Okay.
so many things.
Okay.
It's not always easy to.
Yeah. For example, our diagnostic categories now are based on the idea of either the person comes in with experience of distress, or other people are distressed by their behavior or their emotional state. But so that's very limited, though. So that's one of the controversies in the current state of affairs in my field, which is distress the only thing that says that someone has a pathology? What about the person who has no conscience, has no sense of guilt, and acts in a way that is contrary to the, I don't know, our social, norms, expectations, even, acts in that way, in a sort of sociopathic way. So that's very superficial. But I think what it does is that when you look at psychopathology in terms of the distress in the person, you can also consider the distress they're causing other people. But so it doesn't really tell us on a deeper level, is there some kind of anomaly? There you have to, and that's kind of, I don't know. That's a dead end.
So can I ask for some clarification?
Yes.
So to make sure that I'm understanding correctly and thinking of our audience, the advocates will probably have a lot of questions like I do. So if I understand correctly, to get what psychopathology means, we have two main approaches. One looks more for the adjustment. I understand an adjustment of the person to reality.
Yes.
And the different stages, and so lack of adjustment to reality. So development understood as getting more in sync with reality.
Right.
I don't know. And another that looks more for problematic situations. Is that what you meant, or didn't I get it right?
Maybe. I think. By and large, yes, you're getting it right. I'm thinking back to a supervisor of mine when the people would come to the hospital and they'd be gravely ill, right? They'd be perhaps out of touch with reality, psychotic, or severely depressed, so much so that they're considering suicide, or they've been struggling with that. So obviously distress. But he would say the goal of our work, which was obviously to alleviate human suffering and obviously to alleviate pathology, was to first of all, to gain skills, but also to alleviate the distress. So it's both simultaneously. We were trying to get someone, we have to know something about what the human condition should look like, or what we hope would look like, optimal development, right? And we can talk about that. What is that about? And then also alleviating distress. We don't want people to be in distress, feeling that they can't go on, that life is not worth living, so on and so forth. So you want to give people both, like, let's say that with the suicidal person, where can they find purpose, which is the healthy sort of dimension of life, and how can we eliminate that sense that their life isn't worth living? So both. You want to do both. And when you work with someone, you have to be thinking about both aspects. Yeah. The things that make them strong, their virtues, their skills, what are we hoping for them in their life, as well as trying to figure out where did all this distress come from and originate. So, yeah. And
you mentioned some stages in the development. Can you please explain that?
Well, we all know that. Sort of, if you
do we?
Because we've gone through the stages ourselves.
Okay.
We've watched other people. If we're observant of ourselves and others, we know that our adolescent self is not our mature 40-year-old self or whatever. And as you get even older, like me, the other things begin to happen, and you notice that you become, more reflective, more. You understand your limitations better. You understand you're more at peace with aspects of your life. So those kind of life transitions that we all make based on our experiences, and one would say, as from a Catholic or a Christian point of view. The God is at work in our lives too, presenting us with challenges, purifications, learning experiences, people who come in, offer us something that we didn't know we needed, that kind of thing. So,
is this related, and forgive my ignorance, but
yes.
I am an ignorant. I took a class on psychology like 20 years ago,
sure.
at the beginning of
sure.
theology. So is this related to those, the the oral stage, the anal state, the phallic state. Is this related to that? Has that something to be? Is there like an accepted by most number of stages? Can you please explain that?
Well, that's a whole, that's a huge body of work that's been done. And Freud, who you referenced there with those early, he focused obviously on early life experiences, like the oral stage being, the child from birth to like 2 years of age, and then to the anal stage, being one of the people that, and then the Oedipal stage, which comes into play. And I did start out with studying Freud, and when I was working back there at that hospital, but even there it was evolving. There were other theorists who were helping apply that to our general life experiences, our families. Someone named Erik Erikson was very...
Erikson, the dove, right? That's the one with the doves?
The doves? No.
No? Okay.
Oh, no. Erik Erikson was, he knew Freud in Austria, and then he came to the United States. He actually taught at that hospital where I worked, and I had one seminar with him because by that time he was elderly.
Wow.
But and then he went on to teach at Harvard and such. But anyway, he had this life stages, and he included adulthood as well. But his early stages, like he would say that the earliest stage, that oral stage, where the child is suckling and is totally dependent on the parents. They're learning something, and he called it trust. They were learning trust, how to be in the world in a kind of a state where they could relate to other human beings on a trusting level, right? And then the anal stage came to be where you learned about autonomy. You're walking, you're exploring the world, you learn how to be away from your mother and come back. So it opened up that whole Freudian notion or ideas about the person into, in a way that I think it made much more sense to a lot of people. And and then he even talked about adulthood too. What are we learning in adulthood? Generativity, he would say, for the adult. We learned how to give of ourselves generously to other people, especially the next generation, and prepare them for their lives. And then at the end of this last stage, let's see, what's the last stage? I think the last, I'm blocking on it. Something about, acceptance, kind of a review of life review, understanding where we've gone wrong, what we've done right, making amends, preparing actually for the conclusion of this worldly life. So, yeah.
Okay.
But now even he did not, he had some interest in, he wrote books on had some spiritual kind of aspects to it. I would not say that he wasn't a Christian. I wouldn't say he thought he had belief in that way. Anyway, yeah, that's another whole topic.
No, I mean that's what's beautiful about talking with someone who knows a lot about something, right? You can distill the wisdom. That's beautiful.
I think he wrote a book on Luther and on Gandhi, if I'm not.
Oh wow! Wow. Watch out, because every time we hit the table, it's recorded. No, get comfortable. You can bring the mic to you.
Okay.
Feel comfortable, doctor. Feel comfortable. That's very important.
All right.
So, aside from these ones that I had like a vague idea, but
yes.
So is there an agreement some developmental stages that we all go through, and that's like common accepted by psychologists?
Well, I probably not. Probably it's a variety of people adding to the field, just like any science, supposed science. I mean, it's social science. There's a growing body of knowledge, of understanding these transitions people make, but they're not. It's not so set in stone. It's not like every time the child turns 5, you expect them to be in the Oedipal stage, or at the same doing things in the same pace, because we're all so different in terms of our temperaments, our experiences, and we can talk more about that. There are things that sort of not stunt people's growth, but interfere with their progression, where it makes it more complicated for them. Some of the people
please
we
explain.
see.
Please
okay,
explain. That's very interesting. So, what are typical?
What are traumas?
Oh, it's always trauma that arrests the development. Or?
Yeah, of course, trauma. When I speak of trauma, it could be something as doesn't necessarily mean the major, what would be considered major traumatic events, like abuse, for example. But obviously that is the more severe form. It could be something
Really more than death, or war, or
oh well. Of course, I'm American centric, so I've not experienced dislocation, immigration, war in my immediate life. Although in my family, and people of my generation, we were children. The boomers were children of men who had gone to war. So they brought their trauma back to us. We now know that the trauma of our parents gets passed on to children, even if the parents on the surface don't show any signs of trauma, haven't done anything traumatic to their children. They hold it in their minds and hearts, and without it even alters. They think it even alters. It's passed on even materially, genetically. It's like it becomes part of the person, and they pass it on to their children. So yes, we all suffer with trauma. It's a matter of degrees. Yeah,
that opens a whole chapter about whether psychology is a science, right?
Right.
Because to be honest, I don't have much experience with.
Right.
You're probably the psychologist I have most experience with, but I feel sometimes like we're kind of like throwing little stones in a pond and seeing the circles. Oh well, I have that feeling like it's like a, I don't know, body medicine in the Middle Ages. They had some ideas, the humors, etc. But that's, I don't know if I'm saying something stupid, but that's my feeling, right? This is a science that we are starting to understand.
Right.
We are really just guessing. I don't know. Is that true?
But even physicists, right? Physicists, the further they go, the more they know they don't know. It's sort of that way. But we're at the beginning stages, as obviously in this field. And then the more I look at, though, you talk about with canon law that it has this long history. Well, the Catholic Church has a long history, right? It understands the human person. And there's so much, there are rich treasures to be had there. Like if you think of Augustine, and you read that as a psychologist, you know that he knows these things as well. But in terms of science, study, research, it's useful, and but it tends to be somewhat superficial. It doesn't really tell us about how to take it down to the human person, what their experience is. And like as you say, it's dropping stones in a pond, right?
Like for instance, this came to me because you were mentioning genetics.
Yes.
Right. Like when I was a child, in my little natural sciences book in school, we had these giraffes, right? And we had Darwin and Lamarck, or Lamar. I'm not sure.
Yeah.
So and they kind of were mocking Lamar because he thought that the horse stuck their neck longer and longer with each generation, right? So adapting to the environment.
Yes.
And that's they kind of laughed at poor Lamarck, and Darwin was the god, right? So Darwin had it right. Darwin got it. No, actually, it's arbitrary, random mutations, and the ones that adapt better. Well, recently they've studied epigenetics, and apparently Lamar was right.
Exactly.
So be very careful before mocking any theory,
right?
Because especially with experimental sciences, there's nothing like settled science, right? I'm against reducing science to experimental sciences, right? I think that science is more than a science; it's knowledge. So theology is a science, the juridical science is psychological, the humanities are sciences, but they are not the things that you can count, knowledge, measure. It's a different type of science, and certainly accumulated. So it's certainly possible that trauma is transmitted not only by the ancestral, so the very old information that has been randomly distributed and selected naturally. It can also be that the things you go through in life are passed on to your children, and that's the last science, if you want, that we have, right?
Yes. and obviously the more immediate, your parents or grandparents, those experiences are passed on obviously more with a greater intensity than something millennium ago. But I often think about this. It's not about psychology at all. But I once heard that for Native Americans, they believe that a trauma it sort of stays is passed on for 5 generations.
Wow.
So if you count back, so I think sometimes, now how long is that trauma going to last in that family?
Yeah.
How long is it going to be passed on with some intensity that it will really be determinant of their behavior, their experiences, the kind of relationships they form. But in a way, looking at it from the spiritual point of view, it makes some sense, doesn't it? I mean, that we're all supposed to be working through, we're a human family. We share in these experiences. We should be working on it, improving ourselves, improving what we offer. Anyway, I can go off on that topic.
Of course.
Yes.
And it's super interesting. Thank you.
Yes.
So we were approaching sort of a definition of psychopathology.
Yes,
right?
okay.
And you said that there are 2 main ways to approach it. One is from like the ideal development, so I guess.
Yes.
Please correct me if I'm putting words in your mouth.
Yes.
And the other one is looking at the troubled person, or the person who causes trouble around. Right?
True. Right. So from both perspectives, and our characters, our temperaments, those are born into us. So we come out in the world, and parents know this, that children look different. So, and behave differently. So, the child who is more likely to have to experience internal distress versus the child who's tend to be more out there in the world, sort of a doer. They're more likely to cause if they run into trouble in their lives, they're more likely to cause trouble for other people rather than to feel it inside. So there's the externalizer, the internalizer. That's another way to construct it. But yeah, so I was saying, when you run into difficulty and you're not able to master the task that's being presented to you, sort of like in meeting the challenges at each stage, you tend to get stuck. Right, and the degree to which you now I've lost my train of thought.
It's we're trying to find a working definition of psychopathology.
Yes.
Let me frame this a little bit. So,
yes.
For instance, I understand that we all have whenever we have 2 of something.
Yes.
We have 2 hands, we have 2 legs. We have 2 eyes. We have 2 eyelids. For instance, I have ptosis, which is a thing that one of my eyelids is lower than the other. So people think I'm winking at them, and I'm not, right? But for me, that's not a problem. I have eyesight normal, so I don't think I have a condition. So I understand that whenever we have 2 of those, they are always different. But it becomes a disease or a syndrome or a medical issue when it messes with your life. So your right leg is shorter or longer than the left one, but you are not lame, I think is the word in English. Right? When you're limp, right? That is when you have a disease. That's when you need to go to the doctor, when it's causing you pain in your hip, and then you need this thing, and etc. With psychological issues, is it the same? So we say that someone has a psychopathology when it is causing them distress. Is that correct?
Causing them distress, but I think that's just the beginning. Then you look at how much distress, how much interference has there been on their development. So I mean, like when I do an interview here at the tribunal, I start with knowing something about them in the present moment, ask them about how they're doing, and then I begin with their family. And I want to know about their relationships with their parents. I want to know how early the troubles began and how much interference was caused and what the sources of those were. And I typically, so you're always looking to see, have they met their developmental milestones in terms of their relationships and in terms of whether they're able to operate kind of independently too, but always the quality of the relationships, because that's, can you love and can you work? That's what Freud says. You want to know if the person is capable of loving and of working. So independence and also relatedness. Those are the two. You're talking about two things. That's another duality too in the human person. We want to, as a psychologist, I'm always paying attention to. Are you capable of being independent?
What are the milestones? What are those milestones you're talking about?
You know, did you, well, typically you don't go way back, but, you know, if I were to get to know somebody really well, how did they relate to their parents starting from day one? Were there problems in, was your mother available? Was she able to, did you feel comfortable in her presence? Were you able to have that sense of security? Again, those Erikson kind of developmental stages. Then, you know, how did you fare when you went off to school? Were you able to tolerate that? Were you able to relate to your peers? You know, just all those normal kinds of the things that parents do kind of track with their kids. The same thing psychologists are interested in. And what interfered? Was it something did you have a cognitive problem, an intrinsic, like say you had ADHD or, you know, an attention deficit disorder? Or were you a high-strung kid who was too sensitive? And there are some psychologists who've studied intensively, not Dr. Spock's necessarily, but have the temperaments of babies and how they, the differences and what they need differently from their environments depending on their temperaments. So,
how do you define temperament? What is a temperament?
Well, so it kind of goes back those basic categories of whether they're somebody who can handle stimulation from their environment, for example, and how do they handle it? Are they, and now we also know about that it affects attachment to the parents early on. But there's simple things like, well, not simple, I shouldn't say that because I know the author and I know he's not a simple-minded person, but he wrote a book, The Four Temperaments, using is that classical or medieval kind of understanding of the choleric, the sanguine, the melancholic, and what's the last one? I'm forgetting.
I don't know. Yeah, to me this is not
the
something that comes to
phlegmatic.
Mind. Phlegmatic. Okay, those are what we call temperaments. So temperaments are sort of natural inclinations towards relationship with others and towards a certain state of animus. Like people are like more low-key or more vivid.
Or social.
People are more social or more individualistic.
Yes.
Okay.
And none of them are pathological. They're God-given. And
it's good.
They're good. And they have their strengths and their weaknesses.
So going back to the definition of psychopathology.
Yes.
Because you said that's not all. So probably you're getting at the typical problem today with any medical science, that there is no norm. There is no normal accepted. So it's very difficult to describe a disease because like you go to the doctor today and you say, I am eating 10 chocolate bars every hour. I do that 10 times every day. And the doctor is going to tell you that's wrong. You got to stop doing that, unless the body positivity cult has reached them. But if you go and say, I have sexual intercourse with humans of both sexes and animals, etc., the doctor can't say anything, right? Because there is no, because of political issues, doctors' hands are tied into saying that is wrong, that cannot be good for you. Or I guess with psychological sciences, you have a similar issue. There
is a similar issue, which is why I said the initial thing I said about distress. Is if it's causing me distress, then it's a problem. But if it's not a problem. But that's where we're at. Unless what that means, I think, is that there's just an immediate snapshot of the person. You know, what about 10 years from now? Is that going to be a problem? They're not the doctor, the psychologist isn't thinking, or the psychiatrist isn't thinking ahead for helping the person. I like to take a longer view. Like, where is that going to lead you? Is that going to really get you where you want to go? Have you even thought about where you want to go? How do you think it's going for you? So that's a part of the human person too. We should be planning. We should have a sense of purpose. We should those are those positives that psychologists should be considering. But a lot of times we just start with the distress, and anyway,
like for instance,
it's not enough, is what I'm saying.
I've heard
especially
that
for us here in thinking about marriages, which is a lifelong commitment. Is someone,
Yeah, so I've heard that narcissism, which I want to talk about it later, but narcissism is a difficult condition to diagnose because narcissists are so happy with themselves. Like, no, I don't have a problem. People who live around them are going through hell, but for them, no, life is great. I am awesome, right? So I guess there is a problem with subjectivism in all sciences.
Exactly.
But in your field, that must be a huge, huge problem, right? Because you don't have anything fixed.
Yes.
Right?
Exactly. And so the people around them are experiencing the problem, but they're not experiencing the problem themselves until there is that coming to Jesus moment when everybody deserts them, or they've failed in some way that was important to them. Then they realize that there's been an emptiness that they haven't, they've been living. So yes, and they have to consider that there are other people in the world, and that they should include them in the way they live their lives, include the importance of that in their lives. So,
Okay, so is it safe to say, is it okay, is it true, honest to say that a psychopathology is condition of the mind that causes distress, mainly to the subject, or subsidiarily to others around the subject? Is that something that most psychologists would agree with?
I think so. Yes.
Okay. Oh, by the way, what's the difference between a psychologist and a psychiatrist?
Okay. Well, a psychiatrist simply has gone to medical school and then specialized during their residency or internship and residency in psychiatry. So they're capable of prescribing medication. They tend to be more, they put more importance on diagnosis using our current state of affairs, current knowledge about different types of pathology, anomalies. But and the psychologist has come up through the academic world, gotten a PhD, has been trained in doing research, studying the different aspects of our field, the clinical as well as the diagnostic, and then has done also the clinical work alongside that. And probably is more interested in doing, I shouldn't say that because they're different. Some psychiatrists do specialize in doing psychotherapy and add medicine on top of it, or medicine and then psychotherapy as their secondary. Clinical psychologists often do the clinical work, or the therapist, who try to help someone change what has gone wrong. Okay.
So the next section of the interview, I would like for you to explain us, the advocates and me, I'm very interested, what are, if there is, like the main groups of disease, right? What are the big distinctions we can make among psychopathology? So if it exists at all, I mean, is there like a
well, once again, it's not simple, but the first distinction I make is between those who are sort of in this world, sort of ordinary people with ordinary type of problems, but sometimes can get to a intense degree, sufficient that they're impaired. But and then distinction between those people who suffer with a difficulty in being in touch with reality, knowing what's real and what's not real. I mean, with psychosis or thought disorders, it takes different forms for different people. Not necessarily the most severe, like someone who is hallucinating or delusional, but it can be just problems thinking, having clear thoughts, being able to put together where their thinking goes off into tangents. They can't follow a train. They don't have a train of thought, sort of like what I'm doing right now. Usually it's associated with a high anxiety, right? This high anxiety leads to trouble with a chronic high anxiety leads with trouble just thinking clearly, making decisions that make any sense to anybody else. So, and then there's the ordinary people, ordinary kind of troubles, which we all have. And those can get intense depending on stress. And we know what those look like anxiety, again, or depression, for example, mood disorders. There's some things in the middle that kind of like bipolar disorder, which, again, my experience has taught me that bipolar disorder is usually associated with loss experiences. You brought up death and the loss of someone important to you in childhood sort of sets you up for some mood disorders, including bipolar disorder. So we see that a lot these days. I think that has something to do, going off on another tangent, with the way the instability of families makes people more vulnerable to the negative effects of loss experiences. They don't have as much cushion, as much of a safety net in place, enough people to help them understand what's happened to them and to rebound, resilience. We're looking for.
Yeah, like I think a lot about that now that I am a father. So I have two little girls, so I am the one who puts to bed Maria, our 2-year-old, right? Yeah. And we have our routine. So every night we go upstairs, then we go shower, then we go back, put on the pajamas, read a little fairy tale, then I sing a song. And those little details, if I have an accident and die, these things that are grounding my daughter to a routine, to love, to kindness, to normality, to life, that would disappear suddenly, right? So she would be, even if she has the care of her mother or someone else, that experience is cut, right? So that must be a cause for huge distress, right?
So it does sort of knit together the person, right? And it teaches them where to find a sense of safety, where to feel kind of open to the world, because there's that security that you're offering. Yes, and so we know something about how to help a child who's had that kind of loss of a parent, but we also know that the loss of the parent is a high risk factor for depression in adulthood, and terrible depression in adulthood that's very hard to overcome. It can be, you can compensate for it. You can learn, you can draw on new people, try to develop new sources of that kind of knitting together of your life experiences and with being with somebody else. But that's very tough.
Yeah. So we have a first classification according to the gravity of the issue. So So we say in Spanish, everyone has a window to the north, right? So we all have something, right? So you start studying me and you're going to discover A, B, C, and D, and probably all the way down to Z, right? And then you have your big things, the psych ward, even the dangerous people, and some things that are serious in the middle, but that are not outrageously grave, right?
Yes.
How about other classifications, like for origin of the cause of the problem, or what part of the brain it affects? Are there other classifications or classifications within the ones you make?
We always talk about nature and nurture. So we come into the world with our own strengths and weaknesses, and some people have more difficulty in life simply because the way they're wired, their brains are wired, so that the more serious problems we were talking about is not just that, though. It has to be they have to be not met in the world, and somebody didn't support them, or there were. Certainly there's some people who come into the world with just a much greater vulnerability to psychopathology, and so we don't want to place the blame on poor parents, because we're all doing our best, including the people who are damaged, right, or having trouble, severe trouble. So where are we going with this?
Are there diseases that are grounded exclusively on nature, or that are grounded exclusively on experiences, or it's always a mix?
It's always a mix. But my Christian mind wants to make room for everybody, right? And there are some people who are always going to be different, fall kind of to the wayside, but we should be inclusive of them. Yes, but of course what we do, how we relate to them makes a big difference, because their human nature is still in place. They want the same things that everybody wants, right? They want to be loved and respected, right? So, and acknowledged. But the way you express that with them maybe will be different depending on their degree of pathology. What I wanted to also say, though, is that on the upper end of the scale, right, the people who look and normal, feel normal, have been successful by ordinary terms in this world. There's, as you said, there's always a window north, and there are these cracks that are in us, and we could talk about why that's our being creatures. I suppose we're imperfect creatures. We're also fallen creatures, so we have to deal with sin in our life too. But that's the stuff that psychologists are kind of interested in, like therapists are interested in, because that's where the work happens, where growth happens, when the things that make us slightly different, quirky, unusual, an individual. Where are we going to? So those things that aren't so well adjusted don't necessarily have to be repudiated. It's sort of like, oh, that's interesting. What does that teach us about you and about, where you're supposed to be, what you're supposed to be doing with your life? Like the reason I chose psychology or you became again a lawyer probably has something to do with those little cracks in our personality. People always ask me that. Oh, you're a psychologist. Well, what's your, what was your problem that you decided to become a psychologist? So we know that people choose their professions based on something they want to work on in themselves. So, yeah, I think God put those things in us so that we would keep working.
Yeah, I think, I've heard it. I don't know if it's true. Do you think that most professionals of psychology have an issue, and that's what brought them to study psychology? Like, that I want to deal with my own ghosts, right? So let me go and fight those by studying the problem that I have. That's why people, I don't know if this is fair, but they say that it's difficult to find a therapist that is not crazy.
Right. Or haven't, gotten themselves to a place where they're healthy enough to help somebody else. Yeah, I think that's true. But at the same time, it wouldn't have happened if I had a strong sense of being called to it by, just like somebody says they're called to some vocation. That very early on, I had a sense that I was supposed to use my mind for something like this. You know what I mean? I just did. I don't know. It just came.
It's like...
That's a gift, I think.
For us jurists, I think many of us, I don't know if most, but many of us probably come from an early childhood trauma where we perceive something as sort of an injustice. Like in my case, clearly I was the single child for 4 years, and then suddenly I'm losing all that love and all that. So we yearn for that order, for that justice in the world. So we want to study what is just. We want to. And we got to be aware of that, not to let our traumas operate through us, right?
Exactly.
Because maybe I'm neurotic about it.
Right.
So about the classification. So aside from the gravity, are there other, like the type, the kind of thing that happens when you have this disease? Is there something else, some other way to approach how you classify diseases?
Well, it's just really broad. I mean, like they're developmental. Problems, anomalies, where you don't meet your milestones, and then there are mood disorders, where your emotions rule your life in some way, and then there are the, as we said, the psychotic disorders. They do classify sexual disorders, but they typically are we won't go there too much, but. The paraphilias, the perversions, kind of what we used to call perversions. But again, if it's causing somebody distress, right, then it becomes classified. So anyway, we don't need to go there. We've already kind of touched on that a little bit about how these days things have changed so much about understanding that.
How about cognitive problems? Where do those, like difficulty
well, there's personality
processing
disorders. Maybe we should touch on personality disorders.
Personality disorders.
So that is kind of the person who has where your understanding of self and others is decidedly different than the norm. So now you get into some kind of, muddy waters there, like what is the norm?
Mm-hmm.
So I suppose the easiest one to explain as a personality disorder would be obsessive-compulsive disorder, which is not the same as obsessive-compulsive personality disorder, which is different from obsessive-compulsive disorder, which we also know as the person who is checking doorknobs and making sure their house is locked or has an obsessive thought that they can't get rid of. The personality disorder that also has that beginning of obsessive-compulsive is the person who's a high perfectionist, who has to correct everybody in their vicinity, within their family. Typically, we see them here at the tribunal with the wife or the husband. The person who can't delegate, the person who's kind of miserly, stubborn. Micromanager, but to the extreme. So it's these are normal kind of human adaptations, but taken to the extreme. Mm-hmm. So now, some of the research shows that those things are like temperaments. They're we get those tendencies when we're born, what causes them to be magnified to an abnormal degree? Mm-hmm. And that's a little bit harder for psychologists even to say, well, that crosses over. Again, then we're looking for distress. Does it cause distress or problems in what are, again, our human or tasks, or what we're looking for in terms of to work and to love? Mm-hmm. Has it gotten to such a degree that they are no longer able to get along with other people, basically, or to form, form families, things like that? Mm-hmm. And there's some other, obviously there are others too.
Can you go back to each of the categories and give one or two examples? Like, for instance, what would it be? Developmental, yeah. Developmental. What would be examples of those?
Oh, well, some of those are attention deficit disorder is one. It's under that, I would put under that heading. But also failure to thrive in children who don't bond to their parents. Why? We don't know why that happens. And I'm not blocking now. But anyway, yes. But developmental disorders, there's just sort of fundamental problems that a child well, let's see. There are some that also cover behavioral problems, such as oppositional defiant, which is some of these children will overlap. But oppositional defiant is the child who can't kind of respond to correction in a positive way. Mm-hmm. Take it as a reason to throw fits or tantrums, or forgive me, I think I'm leaving out something too that has to do with withdrawal. But it kind of, again, a lot of this is covered these days when people talk about attachment, patterns of attachment. So the child who can't learn to bond with their parents versus the child who's rebellious and defiant. Mm-hmm. So those are some of the developmental issues that children face.
Okay, so this is one type. Then what other? Sorry, I forgot. So we have developmental problems. We have, you said, mood disorders.
Mood disorders, thought disorders.
Examples of those are?
Well, bipolar, severe depression, sort of ordinary, not ordinary, but more within the normal range of back and forth between, like bipolar, but with psychothymic, which is up and down. Like the person who comes in one day and says, I'm not in a good mood today. And then the next day they're kind of slightly high and giddy, and then they don't, it's kind of operating apart from life experiences. It just sort of operates independently. Mm-hmm. So.
Okay, so development, mood, what else? What
thought disorders, or like psychotic disorders.
For instance?
Schizophrenia.
Okay.
Yeah.
So thought disorders and psychotic disorders are the same thing?
For developmental disorders, I left out the Asperger's and autism, of course.
Okay.
Those start early on.
Mm-hmm.
Right.
These are on the spectrum.
Yes,
right?
On the spectrum.
They speak about the spectrum today.
Right.
Like there are different things that can be
The new term is neurodivergent. People who are wired differently. They experience the world differently.
I heard somewhere that when we hear about the spectrum, we shouldn't think of a spectrum from a linear spectrum of, so you are more or less, but in like a number of things that you may have this, and this, and then you have this, and that. Is that correct?
I would say so. Yes.
Okay.
Yeah.
Okay. So development, mood, thought is information processing. For instance, dyslexia would be one of these.
For I
For
would
thought disorders, or
I would classify that as a developmental disorder. Something you're born with, you're wired differently, you carry it through life, and it manifests itself differently at different stages. So the child with dyslexia is not going to have a problem necessarily there wouldn't be much indication of that until they reach school age when you start to try and teach them.
So what are examples? Thought and psychotic. So thought disorders are psychotic disorders.
Yes.
Why is psychotic? It comes from psyche. What's the meaning of that word, psychotic? I mean, we use it. You're psychotic, but what's the meaning of that?
Well, out of touch
The
with
real
reality.
meaning. Out of touch with reality. Okay.
Yes.
Okay.
Not able to process. You're not taking the input is being distorted. Like you and I are sitting here talking. If you have a psychotic disorder, you might begin to think that person is talking to you because they're wired into the KGB, or what used to be the KGB, right? Yeah. Or not being able to understand or place it. I guess let me think about how a thought disorder would manifest itself in this situation. Well, of course, there's hallucinations where it wouldn't appear, or you would hear things that weren't there, or you begin to explain it to yourself in a way that didn't conform to reality.
So paranoia is
yes.
thought disorder.
Yes.
Double personality. I don't know if that's a thing. People with different personalities.
Double personality really gets back to what we now call multiple personality or dissociative disorders.
So this is a new category?
It's kind of a new category,
okay.
but we've been talking about it for
mood,
30 years
thought,
probably.
And now personality, is that another category?
No, a dissociative disorder is different. Those are kind of classified now with the trauma, things that are a result of trauma.
Am I like too obsessive compulsive? I wanted to classify everything.
Well, you would be good at classifying everything.
I'm a classifier. That's
right. That's right.
Also, I mean, I was graced, and the church gave me long years in the university, and I mean, as a theology, you study a lot of the good method of the foundation of the university, so the scholastics, so first definition, then classification, right? So when you read, in this library, we have a lot of old books, right? And they start, so first define the thing, second classification, well, by age, by type, by nature, by origin, right? Okay. By the way, how about the DSM-5, which is a very important book for you guys? It's it's a manual handbook for diagnosing people.
Yes.
Right? What's the true name of the word of the thing? Diagnostics and sociometric or something like that. The manual.
I don't know.
You guys use it so much that you don't even. Okay, so the DSM 5th edition, the 5.
Yes.
What is the classification of all the diseases that the book contains?
Well, you'd probably be very unhappy with it. I mean, really, it is more just a compendium and trying to classify them, to group them. And each revision, there's slight changes in where things fall. And also these days, people can get, like a person with, let's say, Asperger's disorder or autism spectrum disorder, might have on top of that a mood disorder or a thought disorder. But they do, that it is based on research. Epidemiology kind of mental illnesses. And, there are correlations where things overlap. If you, like with attention deficit disorder, but many people don't know this, but I try to help them understand that there is a tendency there to sometimes have mood disorders for a person because it makes some sense. If you're kind of different, neurodivergent, and you go to school and you're not like all the other kids and you're dyslexic, and other kids are going to make fun of you, or you're going to feel like you're inferior because you can't read as fast as learn to read as fast as others. You're going to have mood problems. You're going to begin to, because due to stress, you'll be often fall into depression, or you might become kind of obsessive compulsive in the kind of trying to meticulously do things a certain way so you don't make mistakes. So these things all kind of
so it's like with the body. It's like diseases of the body.
Oh, true.
So you start having problems here, and this thing makes you walk wrong, and so you have a problem here, and then the lung, and then you don't breathe, and then finally you die. But
and then you look.
You started with a toe being not okay, right? Mm-hmm.
Exactly. Yeah. Very good point.
Yeah.
Then you get your clinical note from your doctor, and then he lists like 5 things that are wrong with you. He said, Mm-hmm.
Okay.
So it can cascade.
Mm-hmm.
So.
And now looking at our advocates' work, what are the main? And this is the third chunk, probably the most interesting for us in the tribunal. So, what are the most common, the most relevant psychopathologies for our line of work? So what are the things you keep finding again and again in cases so that our advocates should be able to identify, that thing. Okay, yeah. Then what are the most common?
Okay. Well, I mean, to exclude the one, I mean, when someone has had a serious mental illness, like I talked about before, the type that requires hospitalization, for example, that doesn't happen all that often. But when it does, it's obvious, it's more clear cut usually that this is where the deficits are and how it interfered with giving consent. But what we're more the garden variety things we get are more likely to be personality disorders. They're pervasive. They're easy to for a person to feel like there's nothing wrong with me. Well, it's kind of the way I always thought about things, did things. So that's normal. What not to understand themselves well enough to know that it has an impact on other people before they enter into marriage. So the personality disorders are the common variety, and then stress related would be anxiety and depression. And again, those go along from mild to severe. A severe depression obviously can make it make it extremely difficult, if not impossible, to form a good discern whether they're ready for marriage, whether that person is the right person for them.
Let's start with the big guns.
What?
Okay,
right.
So in your experience, all these years assessing cases, have you found a lot of the big ones, the people who have been committed to an institution, people who really needed? When you say a hospital, I understand that the problem is so big that it's not enough with visiting your therapist once a week. You really need to be in a place where you're under observation. That's what you meant?
That's right, yes.
So is that very common in marriage cases?
In my experience here, I would say it's probably at most 5%.
Okay. And
less.
What are the main diseases you find, or everyone is completely different to the next one?
Well, it's a toss-up between anxiety and depression. And a lot of times depression can manifest itself as what we used to call agitated depression, which is anxiety, which is really a symptom of someone struggling with depression.
Okay. Oh, so most of the times when people are, is correct to say committed in an institution, or that's the wrong language? Please correct me. When you say sent to a hospital, right?
I meant the most severe or intense, like it's someone who is so depressed that they're suicidal. They've lost, a will to live. That is what I was talking about. So those are very few of the cases we have here. Most of the people are in the moderate range.
Before we move on, sorry to interrupt, but another question is, so those people who have been sent to a hospital, the most common case, among this, which is a small group, in this group of people who have been committed to the institution because the thing is very severe.
Yes.
The problem, the particular problem, is typically depression and anxiety, or is something else?
Oh, I see. For our cases here, I would say typically it's depression, but occasionally it's something more like a schizophrenia of something, or schizoaffective, what we call also, which is kind of a hybrid of the two.
What is schizophrenia?
Well, that goes back to the way most people understand it, someone who's hallucinating or delusional. Although when those subside, those positive symptoms decide, you can be left with someone who, with the negative symptoms, which is a kind of, how do we explain that? Is unable to kind of reason. Yeah, they don't reason. Their cognitive faculties are so poor that they're disinterested in life to the point where they don't really, form ideas in their head. There's sort of these negative symptoms, the absence of mental activity we most have. We, form impressions of people, act on them. That's sort of, something vacant about the person.
So bottom line for our advocates, if you have a client who's being committed to an institution,
yes,
it's usually easier to identify because they have been observed by professionals at the time when the crisis was happening.
True.
So that's easier to have medical records to prove that there was a grave psychological anomaly in our language, etc.,
yes,
etc., right?
Yes.
Okay. But that is a small
Very
portion,
small.
a small percentage. What is the number one problem? Depression and anxiety? So
yes.
please explain to us, what is depression? And why is it linked to anxiety, right? Because depression is here, anxiety is here. Why are they linked?
Yes. Okay. Well, depression is, first of all, usually it often comes on gradually to a person. I tell people that and this is my kind of layman's way explaining to a layman about it. It's like you've had a problem in adjusting to something in your life, and you've worked and worked at it. Your brain has been working and working, because our inclination is trying to solve our problems, and you've not come up with this solution, and your brain eventually becomes tired. It becomes so tired. It cannot, there's a feeling of helplessness that comes with that, a hopelessness. And your body becomes depressed as well. There are physical symptoms of depression as well. You don't sleep as well. Your appetite is off. But usually the sleeping is the key, one of the key questions. Whether you sleep too much or too little, whether you've gained weight or lost weight. It has a physiological component too. But it's the mind and the emotions and the body that's becoming increasingly depressed. And like I said, it's like a problem that can't be solved. So that's why we see it so much in these marital cases. And most people, 9 out of 10, say that at the time they got the divorce or got to the point of separating from their spouses, they're depressed. That's because they've had a problem that they haven't been able to fix. And then the most important relationship, of course, is with one's husband or wife. And maybe even has been the source of the depression to begin with, the constant conflict, right? So that is not the question. No, they're for experts.
So the anxiety is, in that example you say, is the effort to address a situation?
Exactly. The person who is trying to fix something. And so there's where the anxiety comes from. There are other people who experience anxiety without the depression necessarily following, but... so the agitated depression is a person who's still fighting to fix something. And then when you finally give up, then you're into a more kind of a state of depletion. So I often use that word with people too, that they have sort of run out of gas. Right?
What is the difference between having depression disorder and, today I'm kind of depressed. I'm feeling depressed today.
Right.
What is the difference?
Right. Well, yes, we're meant to always be working on our problems, to problem solve, right? Because they come up every day. And so, yes, and maybe it's something that's kind of extended. We're in a state where we're kind of like, like a midlife crisis, and there are little ones and there are big ones, and you're working on it. But can you kind of find your way out of it? Can you begin to solve the problem, make some small changes that make life feel better, that you've reached, when we would say again, we begin to understand ourselves, our purpose in life, what our meaning is, what gives us meaning, or do we run into a major roadblock? And that's when the other variety of depression starts, right? When it becomes more of a clinical problem, because you're not finding the solutions you need. But yes, most of us we have our moods, and that's fine, and that's normal. But are we free to learn, to grow, seek solutions from other people? I hadn't said that before. That's one of my other things that I return to over and over again with people is, have they learned to use other people in a way that makes other people useful to them, so that can you seek help, ask for help, get help, and receive it into yourself?
Oh, in a good, not in the sense of taking advantage of people, but in a good sense.
Like in a good
having
sense.
Relationships that are productive for them, but also for you. I mean, you are not... Okay. Would you say that we are like a fish out of water and there is an epidemic of depression and anxiety? Is that accurate to say in today's world?
I would say what's the epidemic is people struggling to find a sense of purpose for themselves. What is their purpose in life? What are they meant to be doing with themselves? And so of meaning, a crisis of meaning, which leads, if without that, then when you hit those bumps, it's harder to navigate those without suffering from depression or anxiety. So meaning is kind of, Where do we get that? I'm so many times I talk to people here, sometimes at the doing a life history review with them. I ask them, so your parents never talked with you about the meaning of what your life was supposed to be like? No. Yeah. Or about relationships? No. What they're supposed to be doing with themselves? No. I mean, there's something to be said for, not everybody's verbal, right? But did they at least model it for you? Did they take you out when they were working in the yard? Did they take you to show you how meaningful work was, or did they model it in some form, either verbally or just behaviorally for you? In a way you could take in too, because each kid is different. But
yeah, we've had this conversation before, right? 2, 3, 4 generations ago, depending on the place and the particular family. We took care of the physical needs, so we finally all were fed more or less okay.
Yeah.
That was the first thing. Then we got the next generation gets the intellectual needs solved. Like first, they go to college, they can read, they can study, they feel the pleasure of knowledge, right? And only after that we get the emotional needs covered, right? Like you said, parents used to say, well, I gave you food, I gave you clothing, what else do you want, right? I didn't have that when I was a child. And then now it's, but my feelings, but that's very last generation, 2 generations ago. I mean, my parents' generation in Spain, they thought that going to the psychologist was only for crazy people, right? And I think that's most of the world, right? It's only very, very recently that it's okay to go see someone and talk about your problems and your things, other than confession with a priest, which is not that, it's not therapy exactly, even though it has a therapeutic side to it, right? This need for covering my emotional needs, it's very new.
It is very new.
We need a lot of base until we can build up to, well, now let's feel all right? Who cares about your feelings when you're starving, right? Who cares about your feelings when we cannot read, right?
Indeed. So again, being of a different generation than you, and the one coming up, it does make you wonder what their needs are going to be, where they're going to, how different it's going to be for them, even from what we're going through now, and all the changes. So yes, I was thinking about this morning though, before we talked about with trauma, that when childhood experiences of trauma, that's another thing I always ask people about in my interviews with them here, is have they experienced with abuse in their childhood. And so many of them have gotten to my office with no one ever asking them. And I'm the first person they've even told now as adults that something has happened. And it is so important for people to actually, I agree with the new generation that those people need to be talking about their feelings right away, early on, to mitigate the damage it's going to do to. It's the silence of it, and them children trying to deal on their own with experiences of abuse, where so much of the confusion and so much of the disorder sets in their adjustment. So I think a lot of it could be eliminated, and that's one of the questions I always ask. And were you able to tell anybody, or did you tell anybody? Did anyone offer you any type of support or treatment? So I do. I mean, of course, any kind of, as the pendulum swings, and the millennials. I don't know, not the millennials, but whatever. People of this generation, we kind of talk about it. They need their feelings always attended to, and done in a delicate way. That even us boomers think is kind of, we're not accustomed to. So we didn't have that experience. I got my thoughts lost, but anyway, yes, that's one of the things I always ask people: have they suffered any kind of sexual or physical abuse, and if so, were they ever able to tell anybody? And that is a good indication, if they have been able to tell somebody, that they're on their way to healing already. So it's when it's held in, and the child tries to make sense of it, that a lot of the difficulties.
So trauma, going back to it, which is the Greek word for wound, right? And finally, the German word for dream, right? That's Träum,
Oh, really?
right? I mean, I think it's das, and the genders in German, Daddy das. I don't know which one. You have a Träum, a dream. So trauma is at the basis of one or all of psychopathologies. It's certainly very important to look for trauma when assessing a psychopathology, but is that trauma leads to this thing? Like, is trauma depression, or trauma can cause a number of problems?
Oh, a number of problems. Again, depending
Is
on
always
your
trauma at the base of psychopathology? Some psychopathologies develop without trauma. How does that go?
Yeah, well, if you define trauma, again, we're talking about on a spectrum, kind of,
Okay.
as something that disrupts development. Yes, kind of everything goes back to trauma, and the inability to organize, understand it, one could say that it's almost like it's like sin. It's like how does damage occur to the human person? Where does that come from? And it's the damage that's caused by anything that interferes with development. So, or with the meeting of your, becoming fully who you were meant to be. But we all know that we're all experiencing trauma. We all have had experiences with trauma, a rejection. Some are just more significant than the others. Rejected by a mother is quite different than being rejected from a good friend in high school.
Of course.
Yes. And the person who's highly sensitive and was already kind of fragile, just developed temperamentally or whatever, the loss of a best friend can be, life-changing. But for others, we're resilient. We kind of brush it off and go on.
Yeah, that's something we see in life, right? People go through the same type of experience and brush it off. Yeah, okay. And the same thing destroys other person's life.
Right? Exactly. Yeah. So yes, trauma is at the basis of everything, and some would say that trauma, the effect it has is on disordering the emotions, so that you're overwhelmed with some sort of emotion that can't be kind of ordered and put into place, and that we need other people to help us find our way through that, and that's why being able to receive and accept help is so critical.
There's a beautiful thought on trauma. I heard a while ago, I think from Brett Weinstein, I'm not sure, that he says the fact that we have a thing called post-traumatic stress disorder, like the typical soldier that goes to war, sees a friend torn to pieces and is disadjusted for life, right? That is that shows that we are a peaceful species, right? Those theories that we see, for instance, in the Space Odyssey movie by Kubrick, right, where humans become violent the moment they become humans, right? That those are apparently not true, right? The fact that seeing violence disrupts you means that you're not made for violence.
Right.
You're not like a tiger or a cat that murder other animals.
Right.
Murder destroys us, right? Like I love that movie Unforgiven, right? With the director is the tough guy, the Dirty Harry actor. What's his name? Right?
Clint Eastwood.
Clint Eastwood,
Okay.
who's having this tough kind of personality. He's such a fine sensibility person, right? The movies he's directed are all so beautiful and sensible, I think is the word in English, right? Yeah. Like they have this thoughtfulness, right? And in this movie, there is the brat cowboy gunslinger. I've killed this, I've killed that, and finally he kills someone, and he's destroyed. Like I've taken a life, I've taken a life, and that's so beautiful, right? Showing that we are not made for
essential
violence, for seeing these things. You're not made for killing, right? A murderer is someone who's okay with killing, has a problem in the mind, right? That's not okay to be like that.
As a layman, we would say that's a madman, right? The one who takes a life. Yes.
Exactly.
Yeah, they've lost their human essence, yes.
So, for what I hear, the most common psychopathology we see is that tandem anxiety, depression, right?
Yes.
Okay.
It's kind of alerting us to a fact of there's something that is amiss that has to, needs help, needs to be taken care of. Anxiety in particular is a signal that there's something that's amiss.
Another beautiful thought on anxiety was a piece of advice by an astronaut who I saw, where he was saying stress is your body telling you you're not ready for something, right? And they said we were sitting on top of a building of flammable
material,
right? And we're going to be thrown into a place where you cannot survive, and we're going to touch the moon, come back. But we were not stressed because we've had drilled and drilled. So we had exercised every possible outcome. We were ready for it. Right? So even though it was such a terrible thing, we were not stressed. And the advice of the astronaut is when something is stressing you, try to focus, think down, prepare as much as you can. And that is gonna. Is that good advice?
That is very good advice. That there was a study long ago. About parachute people deciding to go out of a plane, right? Jump with a parachute, and they found that the people who waited to the last minute to think about what they were about to do, their anxiety went off the charts. But the people who 3 days before they were about to make the jump thought about it, what it was going to be like, prepared themselves mentally, they were kind of in a normal range when they decided to jump out of the plane. But, so yes, preparation, being able to think ahead, is good for us. So,
okay. So what
maybe it should apply to marriage too.
It totally does. It totally does.
Think ahead. What you're about to do.
I had this teacher many years ago now. Well, many years ago, a bunch of years ago. Who said that matrimonial preparation, as we typically understand it in the church, is kind of wrong. Because preparation for marriage is not a course. Preparation for marriage is the life you live since you're a child with your parents. So how you develop virtues, how you become able to endure difficulty, how you learn to have a conversation, to take correction, to deal with stress. All that is marriage preparation. It's not like I'm going to sit you down, put some concepts here in the blackboard and you're good to marry. That's not how it works, right? It's not an intellectual thing. It's more about developing virtues, right?
Right.
Okay, so what comes second after this tandem? What is the next big thing after depression and anxiety?
Well, I would say the personality disorders. Someone who's not aware of the way they affect other people, or that they're different. that their way is not the normal way of doing things. Again, a narcissistic personality disorder, someone who doesn't understand that they're very self-centered and that that's not normal. I mean, not ideal. Not what marriage would make it easy to be married. Again, I don't think that people who have personality problems, it's a total impediment. It's more, are you beginning to unpack that in terms of how it affects you and other people? What limitations do you have? Can you present it to the other person as like, I know I'm very stubborn. Can you help me with that? I mean, wouldn't that be the ideal that we're looking for when someone enters marriage?
So I love that you touch on narcissism, because it's the typical accusation from the ex, right? My ex-husband or wife was a narcissist. That's something we hear all the time.
Right.
And not only here in the tribunal, everyone is accusing everybody of being a narcissist.
Yes.
And I think narcissism, the more I try to understand it, the more it escapes what is narcissism?
Well, there's our garden variety narcissism, which is just our human. I would say it's not really narcissism. It's just being, by our fallen nature, we tend to be selfish and egocentric. And one thing what marriage is meant for is to get us out of that, to teach us how to be concerned about the other person's welfare, not about simply our own, to become listeners rather than speakers. But then there's pathological narcissism, which is really built on a need to put other people down, whether you do it outwardly so that everybody can see, or you just do it internally. I'm superior to other people. I don't have to affiliate with normal people because I'm special. That's pathological narcissism, and has its origins in.
Please explain. Yes. I think everyone is going to be very interested in this.
Where does that come from?
Yeah, where does narcissism come from?
I would say most psychologists would say it comes from a failure of empathy for the child growing up, where they felt unmet, unrecognized, they were not received or understood by the people in their families, in their life. So they've developed their own way of rationalizing it. They've developed their own strategy for trying to get themselves on some equal footing so they could go out in the world and, do what they needed to do, survive emotionally and, just in terms of instrumental activities. So they've convinced themselves that the reason why this failure of empathy has occurred is that in fact, they're so different and so special and so wonderful that no one can compare to them. And they're going to make sure that continues to happen in everything they do. So that's pathological narcissism.
Okay, so
you're asking about why does everybody say their spouse was narcissistic? The closer you get to somebody, the more you're going to feel that rub that they're not so much interested in you as they're interested in their own agenda, right? Or you're going to notice those deficits. So yes, they're going to be aware of the narcissism of your spouse in that kind of garden variety way, I think.
What do you mean when you say garden variety? What is?
Well, I mean just that we're all kind of.
Like
the child starts out life not really understanding other people, and then you grow in that understanding, and when we people enter into marriage, they're often, as they say, I didn't know much about what marriage was supposed to be. I was really immature. I was really naive. Well, yes, that's because you're going to learn while you're married, and you have to be able to learn. And that's the kind of garden variety. That's just ordinary human development. We have to go from being egocentric or concerned with ourselves to being concerned about other people. But now you got me. I know. You and I used to joke when we talked about this that I called it the situational narcissism, which is what people who have had bad marriages where they've not gotten along, they become narcissistic as a defense. Like in the moment of dealing with a troubled marriage, then they try to only think about themselves. As to just be protective. So situational narcissism, I call it. But the pathological narcissism doesn't happen all that often, really. It's like any personality disorders. it's not usual. You know? Yeah.
So when we hear this thing, there is an epidemic of narcissism in society, and it's usually linked to the iPhone. I mean,
Yes,
the
that's-
smartphone, the screen, always looking at me, my image,
Yes.
me.
Yes.
I kind of joke with my daughters. So one is about to be 1, and the other one is 2 and some. I kind of joke they are bipolar narcissists because they go up and down emotionally all day long. I mean, they have in an hour the emotions that I have in a month, and they are crying because it's the end of the world, and next time they're having fun.
Yes.
And also they only think about themselves.
Yes.
Right. So the way
Yes.
to maturity is the way of becoming aware of the other and,
Yes.
and understanding, well, there are more people than me.
Yes.
But I do certainly see that a lot of egoistical behavior
Yes.
around me, that and in myself. I mean, not only around me, in myself.
Yes.
But I see things like people caring only for themselves, thinking only about themselves.
Yes.
Mm,
It's sort of situational. I think because I think that most people can unlearn that if they take themselves. You put the phone down, like parents say, but we put the phone down while we eat dinner. You know, It's like a lack of learning. Something atrophies a little bit, like the social abilities, empathy atrophies when you're not. So that's why we go on retreats. That's why we try to develop healthy habits of how much screen time we have or allow children to have. But yeah, but it's when the person, it's such a fixed aspect of them they can't learn from, even when they put down the phone, to be concerned about other people.
And is there something like the other extreme of the line? Like, we all understand that if you are still like a 2-year-old and you only think about yourself and your feelings, and everyone else around you are just tools for you to use, like the psychopath that becomes a politician, right? Is there something like you were too socialized, so you were taught too much about caring for the others and only thinking about the others, and you don't think about yourself, so then you, from a Catholic Christian point of view,
Yes.
you are unable to fulfill the great commandment of loving the others as thyself. So if you don't love yourself correctly,
Yes.
you are unable to do good for others because you don't. Is that a thing? Do we see that people who don't
Yes.
think about themselves at all?
Yes. So, what seems to me happens with those sorts of situations, when someone's been so highly socialized in a kind of rigid worldview that they don't take into account their own needs, and that hasn't been allowed in the way they've been spoken to. And some cultures are more like that than others, I suppose, right? Fail in that way. Often it's where, you probably know the term for this, where they think the human nature is essentially bad, so it has to be kind of drilled out of you to, in those kind of families, they expect you to be bad unless they socialize you so strictly. Those sorts of environments for people tend to still breed a kind of internal resentment that, is underneath. So yes, so the people pleasers, this world, that in that space, it's kind of passive. It's passive aggressiveness, kind of that happens because what they're doing is setting themselves up and other people up for failure. Because it's not possible to not for any relationship, especially a marriage, not to enhance. It's is aimed to enhancing the development, the spiritual growth of each person. So. Spiritual and emotional growth of each person. So if you're suppressing yourself, you're not building a marriage. So
Yeah.
And people, people can learn to reverse that too. And it takes effort and the help of other people, sometimes a therapist.
So in very layman terms, or maybe pastoral, more like kind of parish talk. This would be. Marriage is not about finding someone to fill your life with. You should have a life and then bring someone and share with them your richness and their richness of life. Right?
Yes.
That is the right approach.
And at the highest level, I think it's offering that self to the other person for their benefit. But you have to own it first. You have to know who you are to give it away. But you're learning. I mean, again, I think it's a learning The one quote I remember from what is her name? I think it's Saint Mola. What is her name? What's her first name? Gemma Mola. But anyway, she married late in life. She was a doctor. She eventually was canonized after she didn't have cancer treatment when she was pregnant with her child, and she died after the child was born. Canonized, I think, by John Paul II. But and I should know the saint's name.
Oh, an Italian lady,
yes.
The one that appears with the eye patch in the
yes.
pictures.
Yes.
Yes. Beautiful testimony.
Yeah, yes. Mm-hmm. They have letters of hers that she wrote before marrying her husband, who was also a physician. And the question she asked in these letters to him was, "What do I need to do in order to make you happy?" I thought. So obviously she was a fully formed, beautiful person already, but that idea that she was entering, not in that kind of people-pleasing way, but she fully knew herself enough but wanted to offer what she could for the benefit of others. So anyway. So
yeah, we only find meaning in life when we give our life to someone.
Yes.
Right? I mean, it's either God or your children or your spouse, but our life is made to be given. So if you don't own yourself, make something beautiful and make an offering out of your life, you're going to end up frustrated, without meaning, right? Meaning is what... So the problem, I usually say, is not working a lot. The problem is working in a bad environment where you don't feel, what am I doing, right? But if you're happy with what you're doing, whatever it is, raising a child or leading a tribunal or whatever.
Right.
So if you're happy and you think, wow, this is meaningful, I'm doing something, that is the biggest strength for us, right?
Right, the satisfaction. You feel satisfaction, then yes. Reminds me of something else we were saying earlier, but it slipped my mind. Okay. Yeah.
It will come back, I'm sure.
It'll come back,
It does later when you're saying something else.
Yes.
Okay, so we have depression, anxiety. We've touched on narcissism. How about addiction? I think it's
you're right.
a
We
very
haven't talked
big
about
one,
addiction.
right? What is addiction? How do you define addiction? Because
Yes.
by the way, we also hear all the time, no? He was addicted to pornography.
Yes.
She's addicted to work.
Yes.
He's addicted to this. He's addicted to that. What is addiction?
Well, yes. And now you're asking me, there's the behavioral level, and then there's the physical level. But they do believe now it has to do with the pleasure centers of the brain, whether you kind of rewire yourself so that you only find pleasure in certain activities. So, yes. So I do think pornography can become an addiction. I think they're proving that now, but they've already... designated gambling as a possible addiction, but of course we always know about substances, alcohol, and that makes more sense. You take something into your body, and it's going to alter the way your body works, including your brain, and allows you to have a need, in a sense, for that. In order to stay in a stable state, you need that alcohol or you need that drug. But so can gambling become like a drug? Yes. Can pornography become like a drug? I think they're proving that now. Not your garden variety pornography, like, people experiment when they're growing up or in their teens with something or other. But when it becomes a need that the person requires in order to feel in a stable state to go out and work or whatever.
Okay, so I see. I hear about withdrawal as a sign of addiction.
Yes.
Is that correct? So, some drugs have a strong withdrawal. For instance, caffeine. I am an addict to caffeine.
Yes.
And denying it would be stupid. I've tried quitting twice.
Yes.
Once I tried cold turkey. For 2 days I didn't know who I was. It was horrible. Right, but regardless of being addicted to that, because I was thinking of coffee, right? It fits the bill. That description is exactly what I have. So we use coffee to be awake and to work, right? But I wouldn't say I have a problem. I think I am very happy I have coffee, right?
Right. Well, it doesn't cause damage to your body. Well, it can, depending on if you go to, again, you can go to super extremes. It can. If you have a heart condition, you better not have coffee.
Yeah.
But yeah, so you're right. I mean, it's put in context. You have to always put these things in context.
So you can be physically addicted to a substance,
Yes,
and and not have a pathology.
because it doesn't interfere.
Because
you're
you are
physically or mentally with you.
like also in the show Dr. House, MD, right?
Yeah.
He at some point he says, "Yes, I am an addict." He had a problem. I think he was taking, I don't know, painkillers or something.
Oh.
He was taking extremely strong painkillers, but he was a high functioning, not functioning, high functioning, like the best doctor, the most. I mean, he's kind of a Sherlock Holmes of the of disease, right? And he says at some point, "Yes, I'm an addict. Yeah, let's have it." Right. But addiction is rampant today, right? I mean, we have so many cases. I think the U.S. is one of the countries with the highest alcoholism rates in the world. I don't know if that's true. Oh, well, maybe it's not true.
But again, they're diseases of affluence. I used to tell my kids poverty is a blessing. I mean,
Yeah.
as long as you have a roof over your head and you have food on the table.
Yeah.
But because your options are more limited, and you're not as likely to get into trouble or fall into. Yes, the children of affluent families, or they're more temptations and more avenues for getting into trouble. So. Yeah, our options, as we get more opportunities, we can find more things. And it depends on your own physical makeup, whether something hits you or not. I mean, I can remember being in college and going to fraternity parties, and you eventually, if you went to enough of them over a period of time, you would figure out who was going to become the alcoholic and who was just drinking.
How can you figure it out?
They were in love with the drinks, They were drawn to them. It became emotional attachment versus the person who was just using the alcohol maybe using it to become more socially kind of free, It's a lubricant, as they say, for social talking with others. But yes, you could sense that more of their attention was given to the alcohol, lining it up, serving it, trying different kinds, reminding people we're going to have a drink later. I mean, it's like it becomes an organizing principle for them.
Do you think? This I think is very clear that nurture, so the environment and adjusting to the environment plays a huge role in addiction to substances. But do you think there are also like predispositions that come from our makeup, like I don't know, some receptors in the brain are more prone. So because like you were mentioning, I was thinking of our own childhood in Spain. We didn't have any of the laws that are here. I mean, of course, it was perfectly legal to purchase alcohol at any age. There was no limit. And I think when we come here, we think 21 is crazy, right? Like that is. I don't know about this. Maybe I'm saying something stupid, and please forgive me for that. Forgive me, guys. But I feel that I think that it kind of encourages, right, the addiction to have that as the forbidden fruit, the thing that you cannot forbid drugs. It doesn't work. I mean, we've been dealing with the war on drugs for decades now.
Yes.
It's the opposite effect. So people are more addicted than ever. You have a stronger drugs than ever. You have cartels, like in the governments of countries. I mean, we're destroying the world, and we keep no. You gotta forbid this. You cannot forbid these things. You gotta learn kids from the family. Yeah. Hey, the world is like this, and you gotta learn to regulate yourself. This is not the way to deal with drugs. Since we're talking with addiction, right? And I'm more and more persuaded. Maybe I just have anecdotal evidence, but I mean, the more I live, the more I think this is crazy. I mean, so you can buy a machine gun and you cannot sip a beer. That's nuts. So when I came here to college, right? As a exchange student, I was already in my 30s. So I was, but I remember seeing the kids, which were adults, so 19-year-old, 20-year-old, drinking like, what you doing? Hey, what's that? I mean, it's forbidden, so they do it in secret.
Yes.
Instead, it should be like, hey, okay, so now you have an age, you can, okay, so you're gonna sip like we do with coffee, right? When we're little kids in Spain, I mean, where I come from in my family, you know, when they drink the espresso, right? The sugar. There are some sugar is there, right? With the coffee, we call it las gutirinas, the little drops, right? And they allow you that's super sweet, and that's how you are aware. But if my first experience with coffee was when I am 21, right?
Yes.
Because it's forbidden, I would be yearning to have coffee. And the first day I have straight 3 cups of coffee. That's crazy. That's,
Yes.
right?
Well, I do think that. I absolutely agree with you, but it made me think about, like, why did the United States develop this attitude toward alcohol, for example, and that it came because all these immigrants were coming to the United States and all using alcohol. The men were living on alcohol and getting drunk all the time because I imagine, due to their stress of their lives, right? That stage in our history, and then Prohibition came. And then they kind of tried to modify that, but we have kind of swung back and forth about tried to limit alcohol because of this history in our country, where it was a tremendous problem with alcoholism among the men who were immigrants in this.
Yes. I watched the Ken Burns documentary, the series on
really?
Prohibition.
Oh, did you?
It's fantastic.
I didn't watch it.
Very interesting.
Yes.
I mean, how it was basically a feminist movement.
Yes,
right?
it was. The wives,
the
it
women
said.
who said, enough of my husband coming home, spending the whole salary
Yes.
in the saloon.
That's
ban
right.
the saloons.
Yes.
So I get it. It comes from a good place, but it's wrong.
Yes.
It's like so many
It's
things that come from a good place, but are
short-sighted.
wrong, right?
Short-sighted.
Exactly.
Yeah.
And I mean, we jurists have the role in society to look at all so to try to give some common sense, some equilibrium in the thing, and say, yeah, maybe you solved this little problem here, but then this wave of problems come over you, and you have here crisis after crisis of opioids. This is a topic I find fascinating. Right?
Yes.
How the relationship with drugs, which is not moderated because you don't have a tradition. So the U.S. is more a project than a nation, right? It's more like people who say, hey, let's do things this way, which is fascinating. It's beautiful. That's why we all want to come here. It's great.
Yeah,
so
great experiment.
Freedom, pursuit of happiness. Yes, I want that. But the problem is you don't have a tradition that has been developed through the generations and the centuries, right? That's why they say the French don't get fat, even though they eat all these things. Because they have a very, very serious culinary tradition. So they eat in a way that has been tested through time, as opposed to what we do here, which is the watermelon diet, and then you only eat watermelon, and then this thing, and then now chia, and now the super thing, and you're always like bouncing from one thing to the other. Like with drugs, I think here before the Europeans came to these lands, right? You had the peyote ceremony, and these things that are still persistent. And we also had that in the ancient world in Europe, right? Like the initiation cults, where Plato and Aristotle would go to a place and you go through an initiation, right? But it's guided and it's a moment in life, and then they give you a drug and it's mind altering. But but it's not the recreational drugs, get high in the sofa and eat pizza thing that people do here.
And you're on your own, with no guidance.
You're on your own. You come home with your six-pack and you start chugging and that dysfunctional relationship with alcohol that I see here. So, like, I have something, I need a drink. Why? Why do you need a hug? You need to go for a walk. You need a good talk with a friend. Why you need a drink? What's the drink going to give you, right?
Yes.
So I think the lack of a healthy environment that introduces you to drugs, violence, sex, all these things you need to learn in an environment, in a community. You cannot figure out everything on your own. And that's why, right, this addiction problem is so huge today.
Right.
Because
the
it's
lack
huge.
of guidance plus the opportunity or the availability of these things and unsupervised.
Also, the general stress of life. So we need something to cope. We need something. I mean, I would love to sleep 10 hours every day and don't need to drink a cup of coffee, but I need to work. This world we are thrown into is very demanding, so we need coffee to keep up, right?
Well, that's true.
Mm-hmm.
That yes, the increasing demands on us. Yes, that's true. And I think that those only heighten that. So maybe that's why this current generation is so interested in dealing with their feelings, because there's more information. Constantly we're being bombarded with more and more demands on our attention or time. Oh, I was going to tell you the story. I learned as an adult that not pretty recently, actually, from my father, who's still with us. Thank God.
Thank God.
Praise God. And he said he made a conscious decision when we were growing up, because he had seen somebody in his family who was an alcoholic, earlier generation, that he never came home and had drinks. He did not want us to think that that had to be a part of our lives. The way we structured our life is to always have a drink. Like the cocktail hour. He wanted us to just know that, or to witness him drinking. Praise God, nobody in the family, the 9 kids, anybody has a drinking problem, right? It wasn't integrated into our world. I mean, we all have a drink now and then, or have wine with dinner now as adults when we get together, but it's like, it's not important to us, right?
Yeah,
it wasn't important to him.
Yeah,
it
the
wasn't
question,
important to
do you
us.
drink? In Spain, I don't think I've met anyone. I probably have, but I don't think I've met anyone who never drunk. Right? It's not a part. We don't think about that with alcohol. We do with other drugs, right? But we don't think about do you drink? Yeah. What do you mean? Do you mean if I am an alcoholic? No. But if you offer me a beer, maybe, I'm usually, I don't know, maybe not. I don't like strong drinks, but I mean, if I have to, of course I do. But no, I never drink. This is, that I don't know, it's puritanical tradition, right? I don't know where it comes from, but certainly it's surprising to me. And the thing that, the come home and have a drink, they have the bar there.
Yes.
The bar, the institution of the bar, right? So we have this cafeteria, pub kind of place in Spain, and we call those bars.
Yes.
But I didn't get the point of bar comes from the bar, a bar where people sit and what are you doing? They're drinking, right? And then they knock twice. You don't need to even speak to get more of the drug in your system. I mean, those things are surprising. Right?
Yeah, the message was to get through life, you have to have this escape into an alcoholic drink, right? So I think that's what my father was trying to tell us, that you didn't need to escape from life. Deal with life. Face up to your problems, whatever they are.
Okay, so we have addiction to substances and addiction to behaviors, can we say? Like watching pornography,
right?
I guess all the sexual world.
Yeah,
is
it's the
very
thrill
prone for this.
seeking. I think the sort of the arousal of certain chemicals in the brain, and you begin. Well, you said it was partly what you were saying about alcohol too, weren't you? When you said there's a social component to it, or with the kids, the college age, young adults feel that they've been deprived something, so they're seeking what they think is risky or something that's a pleasure that's been denied them. But anyway, so pleasure. It's a pleasure-seeking, risk-seeking behavior that then gets satisfied by whatever stimulation. But you can train yourself to do that. I mean, anyway.
Okay, and what are is it true that the addictions are diseases that you never get cured from? So the kind of AA guy. Hello, my name is Jim. I am an addict.
You can be cured, I think. I don't know.
30 years without.
I guess that's just a matter of semantics. When someone's sober for a long period of time, are they cured? Maybe not. Because if they ever revisit it, it can trigger it again. So it's like they're in a state where they're not addicted or not feeling the addiction. But as soon as they return to it, it's like, yeah.
Okay.
I would say that is the way it goes.
In your experience, what are the most common drugs to which people are addicted nowadays? In our cases, I mean, what are the drugs that are causing more trouble? The opioids, marijuana, alcohol, maybe others?
Well, generally it's alcohol. occasionally.
Alcohol number one.
Yes. Occasionally it's marijuana in the cases I work with here, people I work with here. And the opioids, we don't hear that much about them here. I don't know what the statistics are, though, about how common it is. But the problem with opioids, of course, is that people tend to nosedive pretty quickly once they get addicted to something like that.
Because they're very, very strong. Right?
They're very, very sick with that. Yeah.
Yeah, I remember a few cases, right? And once I had a conversation with one client, one party to a case.
Yes.
And I had been through addiction. It was a beautiful conversation, very interesting. He had become wise through suffering, right? And he had a very interesting take on drugs. And he basically told me the time he was a victim of the opioid epidemic.
Okay.
I don't know, not the current one, the one right before. So not the fentanyl, the OxyContin one, right?
Exactly.
And he told me we either were sick, like when you have a very bad cold, or high. That was basically, we didn't have an ordinary,
a stable state.
A stable
state. Yeah.
Mm-hmm. And that is typical of opioid addictions, I guess, right? Okay, so aside from when the drug, mind-altering drugs, of course, that can have relevance for us, for matrimonial cases, because you cannot process information correctly. So the typical case of the person who's high under the influence in the actual wedding ceremony. How does addiction impair the intellect or the will? What are the repercussions of these diseases, aside from the very mind-altering, so I was drunk, right? Aside from that, how does it mess with the mind, the addiction?
Well, depending on how severe it is, of course, like as I was saying, like with alcoholism, what we call alcohol abuse disorder, it interferes with a person being able to set reasonable, sort of understand what's important in life, right? Because the alcohol becomes the primary love object. So can you love anything else, or order your life in such a way that you understand what your priorities need to be? So it messes with your intellect as well as with your emotions. So of course you're driven to you're more focused on obtaining that substance rather than on I don't know. It's very short term, right? It's moment by moment sometimes for people, or day to day. Can you plan ahead when only the thing you're only interested in is getting enough alcohol in your system? So. Yeah.
I see. Okay. And the addiction to behaviors other than to watch pornography, are other behaviors that are very relevant to you that could be described as addictions?
Nothing comes to mind right away.
Like,
what do you think?
I hear about the workaholic,
Yes.
the person who's addicted to high-risk sports. Are these things...
you mean the endorphin rush that some people get from their...
okay.
Yeah.
Is that
I put
a
that
thing you
sort of
see?
in the classic, that sort of same category as, like, I love coffee too, and I like to start my day with coffee, and it makes me feel good. And I use it to, rev myself up so that I can be productive. So, but I think that's within kind of normal range of just things that make us happy. I like fashion. I like to think about what I put on my, each day. It's just part of taking care of ourselves, I think.
Would you describe those as proper addictions, or
No.
it's more like okay? How about sex addiction?
Oh.
Is that a thing? Is real, or do you think it's not?
I don't know that it qualifies. I don't necessarily put it in my... I have said that about somebody. They have a sexual addiction, but I don't think in terms of classification it really falls into addiction.
Okay.
Yeah, because it's so much a part of who we are.
We've
sexuality
heard about nymphomania. and the opposite, frigidness,
Yes.
typically for females. But you believe that comes from prejudices about how female sexuality should be more pleasureless and closeted than male sexuality. What do you think?
Well, I guess I say I don't think of it as formally as like an addiction, because I don't think. I think the origins of some of those sorts of problems, nymphomania or frigidity, it has to do with attachments and attachment disorders and the social life. It is not about. Now, I think pornography is different. It's an external stimulus that's coming into our awareness versus something we have developed over time that works in terms of organizing our life in relation to other people. So it's an internal construction.
And on
and
top
that's
of
how
that,
I could be proven wrong, and I'm open to that.
I guess, yeah. No one knows the whole truth, only God.
Yes, but I would think some of those are just a continuation of some of those personality disorders, those tendencies to kind of organize ourselves in a way that makes sense to us and keeps us feeling safe and secure. So, yeah.
Okay, so the big guns here are the tandem depression and anxiety. Then I don't know if narcissism is a very big problem or not. Did you say it was a big one, or
really, in terms of the way I define it with the pathological narcissism, it's not that common.
Okay. The personality disorder or the trait of being narcissist inclined.
Right.
So what is not common? The disorder, the personality disorder,
yes.
That is not common.
Yes, the pathological narcissism where you think you're superior to everybody else and you're out to, make that happen.
Yeah.
Put everybody else down.
Yeah. Which I understand for you mortals, but for me,
that's right.
For me, it's not a disease. For me, I am just
special. Yeah.
That's what the narcissist thinks,
yes,
really, right?
Right.
Yeah, of course, you guys. Humility in my case doesn't apply.
Exactly.
That's good for you who have failed. And shortcomings.
Exactly.
Okay. Then addictions. What are other important, relevant disorders that you see often in cases? So is bipolar disorder very common? Is ADHD? What are common?
Yes, ADHD.
Diseases?
I think that's an interesting one. They say about 10% of the population. It probably falls into that category. And again, it's the kind of thing where it's normal for you, and you don't understand that it's not like everybody else. And when you hear about these marriages that don't work, because the person wasn't cognizant of their own difference, and so didn't communicate it to the person that they entered into a marriage with, and the other person said, "I can't live with somebody like that. I mean, what's wrong with you?" And they begin to attribute it to the person's bad intentions or a willful being difficult for them, like a person who jumps from job to job, or a person who forgets every holiday or every birthday. They can't, because it's not important to them, and they take it personally. The other person takes it personally, and like the other person doesn't care about me, and really it's that they've got something going on that's different. So
I've heard that there was some controversy with ADHD, right? Like there are people there who say that's not a real disease, or I mean, I'm just talking about things I see in the internet, right? So, for instance, and they say the child is a little. I mean, what do you want? He's a 5-year-old. I mean, come on, that's not ADHD. He's just a little bit of a troublemaker. He'll grow up out of it. What do you think about that?
Well, I mean, yes, children have to learn to organize their behavior and to learn to focus, and then that grows with age. But there's their children who don't. It doesn't develop in a reasonable way. Who still, upon entering elementary school, are still running around in circles, and jump up and down, and have to be reminded constantly to sit down. And it isn't willful, and it isn't. I mean, I like to say. I have ADHD. When I was in elementary school, I went to one of those wonderful, what I now think it was, and I never say that I owe those nuns. I love the nuns because they organized a quiet, orderly classroom in which I could learn.
Yeah.
If I had been in a current kind of classroom, I could not have learned a thing.
Yeah.
Too much noises, too much activity. Now, somebody with a kind of more less inclined to ADHD, kids who need stimulation all the time. I had my internal stimulation going on all the time. I needed quiet. So I what am I trying to say? I think it exists as a difference. It's not bad. It just has to be understood. Educators need to understand it. Medicine, I think, is helpful for lots of kids. I remember one child I saw many, many years ago, and her mother brought her in, and she was distressed. I don't know if anybody else was saying she was she should bring her child in. But this little person, the first thing she did was run around the waiting room and then hide under a piece of furniture. And I mean, she was at an age where she should have been beyond that type of behavior, right? But internally driven by something that, that was not within the normal range. So, yeah, I think it exists.
Okay. Are screens destroying our capacity for attention?
There is some evidence for that, certainly.
I mean, myself,
yes.
I'm so ashamed that I don't read anymore like I used to.
Yes.
So I open a book and immediately I think, this thing, and then I stop because I have everything in my phone. So my calendar, communications, notes, ideas, the shopping you do it.
Yes.
So, yeah, I think this must have a terrible effect in society. Right? And I think we're coming more and more to the understanding that this is not okay.
Right.
I mean, the cell phone is destroying civilization. Yeah, I don't know, but I think that one generation from now, they would look at our time, and it would be like now when they say, "Oh, you smoke in front of children," and people at that time, yeah, so what, right? Like people would smoke everywhere. They would smoke in Congress. They could smoke in any place outside of a church. I think you could smoke in any place. And now we've realized how dangerous this is, and so we've put a stop to it. So probably it's something similar with. Or even worse, right? Or even worse with screens. How that's messing our ability to focus. To.
Although back in the day, way back, you would read a book, and that takes more effort. And it's gratifying because it's something to hold, and it connects with your body in a way that a screen can't. I'd have a dictionary, an encyclopedia, and the book I'm reading. So that if I did have a question, like you consult your phone, I would have to turn the pages of a dictionary to find the meaning of a word, or or look up their reference in an encyclopedia. So I think
you see a lot of ADHD.
It would. You mean in here? I would say, just about. I don't know if it's as high as 10%, like they say in the general population, but maybe 7 to 10%. Of the cases. It probably shows some of that, especially if when I'm doing the history and I ask how was school, they'd say, oh, well, I didn't really pay attention in school, or I was kind of an underachiever, or gee, and then finally later something clicked for me. I began to suspect that there was some kind of learning problem, especially with somebody who didn't know how to apply themselves.
And in what ways ADHD can mess with our capacity to marry?
Well,
to understand marriage and to choose marriage.
Yes. The first problem is the definition of ADHD is a problem with distractibility and impulsivity. So those are two hallmarks, and there's subsidiary ones. But so impulsively entering a marriage without thinking, they're not used to thinking. They're actually, they move into action without pausing to think. And there you do have some. You have to give some consideration to their immaturity, because you can learn to stop yourself and think, even if you have ADHD. But you have to kind of be taught that or learn it through experience. So
you touch on something, right? Because we always say the immaturity is not a ground for matrimonial nullity.
Right.
Incapacity is based on a psychological problem, maybe a pathological immaturity. What is so maybe a pathological immaturity can be the anomaly, but there is no such thing as my marriage was invalid because I was immature. From the perspective of a psychologist, what is immaturity? How you describe immaturity?
It's kind of like on a bell curve. Are you a little bit behind other people and learning the things you need to learn in order to function as an adult? You know, the biggest thing, of course, is that I think is the anomaly is when someone is not able to learn or not learn at a pace that allows them to keep up with other people their age. So, yeah.
It's very difficult to describe, to define for what I see, right?
Right.
It's more like one of these intuition concepts that you know when he's immature, but
with ADHD,
what is that, right?
for example, or if you have some kind of intellectual challenge, which ADHD kind of is, because you have to have trouble focusing and learning as the same way other people do. They say that their development, their psychological development, is kind of delayed. Really, I mean, especially social development. They're not paying attention in the same way or picking up the cues in the same way other people do. So let's say they say now the normal brain of a young adult isn't fully mature until like 23 or 24. But let's say someone with ADHD, it falls even further behind. I mean, it takes them even longer. So, I don't know. I got married at 21, so what do I know? And I think I was ADHD. I think the thing that, and again, these streams of kind of psychological maturation, I think I learned from the good nuns and from my family that you make a promise, you keep a promise. You know, if you take a vow, it's you better figure out a way to make it work. So, but not everybody gets that.
Actually, I'm happy you brought that up, because that's something I always have trouble with. When they say that the brain isn't fully matured until age 21, 23, I've heard different versions. What is the meaning of that?
Yeah.
What does that mean?
I think they're talking about the executive functioning, like the ability to delay gratification. But who
are
draws
they talking
that line
about?
there? Why is it drawn there?
Like it has some physical qualities that are achieved at that time.
Yeah.
And because I know, and I am seeing it now with my daughters, right? Like the frontal lobe is not fully developed, right? And
yes,
it's clear that our brain evolved by adding parts. So we have the oldest part, like our senses, right? Like sight comes way longer after, and the taste and the smell, which are the two original ones that we share with bacteria, basically. But the developing of our frontal lobe comes later in life. But what do they mean exactly when they say this thing? Because
I think they do mean something physical.
Your brain is not the same as it was 40 years ago, and I mean, everything inside our body keeps changing. So what do they mean exactly by that? That the brain is not fully developed until it's age 21.
And I'm sorry, I don't know the research that shows it, but it is about the physical development of the brain.
Okay.
You take a picture of it and it looks one way at that age, and then at a certain point it's changed and it seems stable through adulthood. But then again, look at me. Probably it's deteriorating now tremendously as I got older.
Aren't we all?
Yeah.
Yeah, like there's this colleague of yours, not from our tribunal, so no one can know who I'm talking about, right? But I remember reading, and it was a court expert, and I think this was a case of not having a Christian anthropology, because he was saying, because the brain is not fully developed, this person was incapable. Yeah. So that would mean that no one is able to get married until age 21 or 23, which is ridiculous.
Right, it's ridiculous.
It's just, it may come from a good place.
Can't get married at 65 when it begins to decline. I mean, what is it? What sense is that? We have these, I think it does come from a Christian anthropology, knowing that God is preparing us for what life is going to present. So yes.
I mean, I think that maybe, like in so many things, faith can give you light, but as the First Vatican Council taught, we have been given the natural light of reason, and with that natural light, we can reach a lot of truths.
Right.
Like, for instance, God as begin and end of everything, we Catholics believe that our natural light of reason can reach those truths. That's taught in the Adem Sancta Mater Ecclesia. I remember we were made to memorize those passages from the First Vatican Council. So I think this is something that you don't need to have faith or to be Catholic to believe, that you can establish contracts. You can contract obligations and duties before age 21. Well, yes. Well, I mean, you don't need to be a Catholic to believe those things. That is something that anyone with common sense can get, right?
Yes. Talk to a child. I mean, starting at the age of reason, it usually was, right, age 8. And it's
for us, is 7 in canon law.
Yes. So, and that's backed up by psychology. We know that children's thinking, Piaget showed the changes in the way a child thinks. And at 8, they can take into account rules and laws and apply them to themselves and choose, So, these days, I mean, it's the irony here, or the paradox or something, is that people say, well, I wasn't prepared, or now I'm sounding too harsh, but I wasn't prepared for marriage. I couldn't make I was too immature. And yet, I was watching somebody on TV last night. Oh, anyway, this gets into the Catholic topic. But anyway, a mother was talking and being interviewed with her daughter who's about to choose her colleges. And the mother wasn't dictating to her. It was leaving everything up to the 17-year-old, and the child was obviously making bad choices. But yeah, we actually, it gets younger and younger, the amount the parents put on the children making important decisions for themselves when I think they probably aren't ready. But by, but yeah. So we have this kind of funny thing where we're robbing kids of childhood and yet then extending childhood infinitely for something like a decision like your, marriage. So.
Okay, and we have bipolar also.
Yes.
Which is something with lithium. Can you please explain what bipolar is?
All right. Well, you see the advertisements on TV for all the medications, which is great, actually, that they're mood stabilizers, which they're called. But bipolar simply means that, there are different varieties. The classic definition was someone who would alternate between depression and then mania. And mania was kind of a psychotic state in which someone was so driven by their inflated mood or euphoria that they would they do very risky things, fly an airplane when they never flew a airplane before because they thought they could fly, or went out and spent $10,000 on, some lavish this or that when they had only $10,000 to their name, right? And then would fall into a depression that could be suicidal, and terrible. Now we recognize that some people go a little bit, have hypomania, when they're just doing something slightly out of the ordinary and because of a heightened mood. And then sometimes fall into depressions, deep depressions, so more depression than the high moods, but it's still disruptive to someone's life because the moods are driving them rather than their intellect. Yeah. So that's basically it. That's bipolar. Okay. And my personal experience, again, from years of being a clinician, is that, we've always known that those things can come on later in life, like in one's 30s, is late, 35. Sometimes they're manifest in some kind of hyper emotionality in the young adult, someone who's entering marriage. You see them as kind of a little bit too emotional about everything, and then that begins to depending on stresses in life, it can become exaggerated into a full-blown disorder. I've always seen that experiences of early loss, like loss of a parent, followed by some other losses, it's like being allergic, bee sting allergy or something. It starts little and it gets bigger and bigger and bigger, depending on the severity of the losses that someone's experienced.
Would you say these so far are the main ones, or is there some other that problem, psychological problem that is also very relevant here at the tribunals.
I think that's basically it. Yes.
Okay.
Yeah.
Okay. It's not a little one. It's not a. It's a lot. It's a lot.
Yes.
Yeah. Do you think that we have more psychological problems now, or do you think that we have the same we've always had? We just are more aware.
A bit of both.
A bit of both.
Yes. The human condition has always been challenging and stable. The stimuli, like we were talking about, screen time, it can bring on problems. The problems within the family, though, I just in my limited experience, seems like it's made for more personality problems that people have because they're not being schooled in the family about what a healthy life looks like. Brought on by divorce, brought on by I would say I kind of
a little bit of either, right? Of both.
Humana vitae, the introduction of the pill and contraception and losing track of what marriage was intended for. I mean, it's all had its influence on us. So
yeah, I think the more our life becomes more and more artificial,
yes,
we are more out of our natural environment.
Yes.
Right. So from being a tribe. Yes. To being in a town,
yes.
From being in a town to being in the big city,
yes.
Right? From having this type of conversation we're having now,
yes.
Often with people, to never speaking with someone more than 10 minutes because you're looking at the phone. Yes. So that is from having big, large families to having just 2 or 3 people living in each big, huge house where you're alone, like a prisoner in your big home, right? So all those things must bring more and more mental disease, right?
Yes, or different.
Yeah.
Or different,
Okay.
Yeah. There's nothing new under the sun, though, really. We're still all trying to find our way home, right, to where we really belong. What is St. Augustine's quote? We're all restless until we rest in God. Yes.
I know it in Spanish. Our heart, nuestro corazón está inquieto hasta que descansa en ti. Our heart is restless until it rests in you, on you, right?
Yeah.
Beautiful thought to put a perfect end to these conversations. Thank you so much, Doctor. Thank you. I've learned a lot. Thank you very much.
Okay.
And I hope our advocates have learned as well.
Uh-huh.
I'm sure this would be very fruitful. Thank you, Doctor.
Thank you.
Thank you.